Okay, so I am getting ready to talk about my public health legislation assignments. My name is Lesmeek Bridgman, and this is for health policy and management. So let's just get started. This is the last assignment for this course. This is Unit 7 course assignment, and never done this before. It actually looks a little foggy right here, but I guess that's how it's supposed to look. All right. So, the nursing profession needs advocacy to ensure that nurses have a seat at the table when decisions are being made that affect their nursing practices. Without strong advocacy in place, nurses may be left out of important policy decisions and discussions, leading to decisions that do not reflect their needs or priorities. One issue that is currently affecting public health is vaccination compliance. We all know that a lot of people have their different biases about vaccines, and some may or may not decide to get vaccinated based on what they may have heard, what they may have read, or personal biases that they have themselves. Vaccination compliance is very important to me, especially when considering pregnant women and young children. This presentation will discuss the importance of vaccination among pregnant women and young children. I am proposing that legislation focus on vaccination compliance among pregnant women and young children as an important issue because vaccination is an issue that is dear to my heart. Unvaccinated peoples can expose those with weaker immune systems, infants, children, pregnant women, and the elderly to viruses that can cause fatalities and severe health complications. I am a mother to 3 children and have followed their vaccination schedules closely since their births. I have ensured that they receive vaccines on time and during the required ages. I have learned that my children have been less sick, and if they did get sick, they recover quickly. I have also practiced vaccination compliance prior to and during pregnancy if necessary. I believe that vaccine refusal should be acceptable if a person has contraindications to vaccine ingredients or due to physical complications. We as practitioners should encourage our patients and our patients, which could possibly be the parents of our patients, to vaccinate their children and themselves so that they can be armed with extra defenses to help them fight off viruses and illnesses. One disease that has been on the rise is measles. Measles has been around for a long time, and there has been a significant rise in this disease globally. Measles can be fatal in infants and children. This is why the CDC issued a health alert bringing awareness to the global rise in measles, encouraging providers to vaccinate patients as young as 6 months. What many do not know or understand is that although they feel well and healthy, they could still be a carrier of a virus that could potentially be passed on to others. McEwen et al. 2023 discusses that mortality or mortality rates are much higher in unvaccinated, immunocompromised persons when compared to vaccinated persons. This is why vaccination compliance is such a big deal. Vaccines not only protect the one receiving the vaccine, but also those who are within close contact. On a state level, healthcare professionals and practitioners should be educating patients about the pros of consistent hand washing to cut the spread of germs, bacteria, and viruses. Vaccines not only protect the one receiving the vaccine, but also those who are within close contact. On a state level, healthcare professionals and practitioners should be educating patients regarding vaccine compliance. They should also focus on debunking any fallacies that a patient has accepted as truth regarding vaccines and their importance. I am not alone when I say that vaccination compliance is important for women who are pregnant and their infants. The House of Representatives, too, believes that maternal vaccination, vaccine awareness, and equality was beneficial to the promotion of public health. In March of 2023, the House of Representatives introduced a bill that will promote vaccine awareness among pregnant women and their children, providing extra focus on those within ethnic minority groups. I believe that vaccination is an issue that should be addressed, and legislative support can play an instrumental role in raising awareness on this issue. Increased vaccination rates will lead to a positive outcome for better public health for all. So I believe that as a future practitioner, it is my responsibility to play a role in helping. This just looks so funky to me. I'm so sorry. Play a role in helping raise awareness about vaccinations, helping patients understand the importance of vaccines for themselves, their children, their family, and also helping them understand why vaccines are important, what they can do for their health, explaining the side effects to them, helping them understand if side effects are an issue, what the side effects are, how long they could possibly last, and what they can do about it. Also helping them understand if a side effect does occur, what is considered serious and what is considered non-serious. I believe that if us as providers come together with legislation and put energies into raising awareness, that not only will it help us on a national level, it could possibly help us on a global level. There are different countries and individuals from different countries that reside here in America and visit America on a regular basis. I believe that word of mouth is the quickest way to influence others. And if we are all talking about, not necessarily all, because you're going to have people that object and have their biases. But if we can make as many aware as possible as far as the importance of vaccination and making sure we are focusing on our pregnant women, our children, our elderly, our immunocompromised individuals, if we're all doing our part to make sure awareness is present, that people know about vaccines and what they do for us all, and how they not only help one person, they help us all. I believe that it will make the world a better place. So yeah, thank you. That was my presentation, and thank you.